Hi, I'm Chris Overstreet, and I have opinions. I also have a wrist brace because a couple of days ago I had my first heart catheterization, what used to be known as an angiogram. That's where they stick a very tiny metal probe into one of your arteries, thread it up to the heart, and check you out to see if you're about to have a heart attack. And yeah, it was not a fun experience, but I came through it okay. They didn't find anything urgent. I'm going to find out the details about it on Tuesday. The thing is, the reason I had that in the first place was because I had a stress test about 2 or 3 weeks ago, and they said, well, under stress, a certain part of your heart isn't getting enough oxygen. And I said, okay, let's schedule this angiogram. And then I had a dizzy episode, which brought it up considerably in the schedule. The thing is, that stress test I mentioned on a PET scan, they billed my insurance $18,000 for that, and I am on the hook out of pocket for $2,000 of that. And this is the paper that this is their estimate for what I will owe on the angiogram. I had to pay $130 just to get in the door of the hospital to have it done. And I'm not 100% sure if you can read that properly. That's as good as I can do. But, yeah, the estimated charges allowable $3,356.92. And I'm pretty sure that that coinsurance thing would have been a lot more if I hadn't... Well, it's literally the difference between my out-of-pocket maximum for the year and my out-of-pocket up to that point, counting the PET scan. Now, bear in mind, I would not have got any of this. I would not have been able to set foot in the door. I wouldn't have been able to see a doctor in the last 10 years without the Affordable Care Act, what is known as Obamacare. My policy is a silver tier Blue Cross HMO that's available on the Texas insurance exchanges as run by the federal government. The thing is, well, I have begun and then paused the process of signing up for next year, and this is why. This is an image of the website showing showing what my policy currently runs per month. $742.30, out of which I'm using the federal subsidies to cover $500 for. Technically, the federal subsidy would cover almost all of it for this year, but I like to have some in the bank that helps me cover the income tax every year, because being self-employed, I don't have withholding. So when I actually have to pay, I have to pay a lot. Not just the income tax, but also the self-employment tax, which is basically twice what's deducted for Social Security and Medicare from your paycheck. So, long story short, current policy per month, $742.30. When I went on healthcare.gov, this is what the exact same policy, keeping what I've got, will run next year. $1,057.83 per month. And I'm actually... my out-of-pocket is nearly doubling because the subsidy went down. It didn't go down exactly, but it's not covering the whole thing like it did last year. Part of that is because in the big, beautiful bill that the Republicans rammed through, the Republicans stripped out a lot of subsidies and failed to renew others. Basically, the overall subsidy for insurance through the Affordable Care Act, those subsidies were cut in general, and the special subsidies, the expanded benefits to individual policy holders that was enacted specifically for the pandemic emergency in 2021, that expires this year and it wasn't renewed. Incidentally, that is why the government is shut down right now. The Democratic Party is trying to fight to get all of that restored. They wanted it done before November the 1st and before healthcare.gov opened up to new signups for 2026. Obviously, that didn't happen. And that is why I'm very much in favor of the Democrats holding out until they get not just a vote, but a bill passed. Vote and passed to restore those benefits. I honestly don't think it's going to happen. I think the Republicans would rather leave the government shut down than do it. But there's not much point otherwise, especially since, bear in mind, the Republicans control the House, they have a majority in the Senate, and at any time they want, they have the 51 votes necessary to do away with the filibuster and pass anything in the Senate they want, and the Democrats wouldn't be able to do a thing to stop them. The Republicans are letting this play out because they think it benefits them. They think people are going to be angrier at the Democrats than at the Republicans that the government is shut down. And they do not give a rat's ass who's hurt in the meantime. Who's hurt by the lapse of SNAP benefits, which, as I record this, are being forced by the courts to come back today. They don't care about the people who are buying insurance by the Obamacare system. They don't care, period, except about their billionaire donors and their tax cuts. Now, I have said all of that, and now I'm going to say something else. The Affordable Care Act is a piece of shit. Let me explain why I say that. Go back to 1993, 1994. Most of you won't remember. But one of the things that Bill Clinton initially ran on was reforming the healthcare system, because already then, under Reagan, it was beginning to break down as more and more companies were treating healthcare as a profit source rather than a way to make sure people stayed healthy. And so he handed off the task to his wife, Hillary Clinton, and said, you get together with some experts and hammer together a new plan that will make sure everybody gets covered. And for months, they debated behind closed doors, and they hammered and pounded, and people kept asking them, well, what's in this? What's going to be in this? And Hillary said, go away, we'll tell you when it's ready. When it finally became ready, nobody was happy. Nobody. Because what Hillary Care did, as it was called at the time, and it's as good a name as any for it since it never passed, what it did was to mandate everybody buy insurance through their employers. If you didn't have a job, you didn't get insurance. If you did have a job, you were forced to buy whatever insurance within certain limits that your employer wanted to give you. If you had a better policy before, unless you negotiated it through a union, they got a nice big exemption. Unless you negotiated it through a union, you were stuck with whatever your boss wanted to give you. And then your boss could threaten to take it away by firing you. So if you got sick, you're not going to change jobs. You're going to do everything you can to keep your job. You're going to even take pay cuts. You're going to work longer hours without pay just so you can keep your insurance. And because the unions also insisted on this, the policies that were covered under Hillary Care were all lousy HMOs. This, bear in mind, was at a time when HMOs were still fairly new and already universally despised. People were having to give up their doctors and go find somebody who was covered in system. So, absolutely nobody liked it. And even the Democrats could not get a majority of their own people to vote for it. Meanwhile, the Heritage Foundation, you might remember them. Most recently, they've written a little thing called Project 2025. They pretty much dominate Trump's administration. In 1994, the Heritage Foundation came out with their own plan as an alternative, a market-based solution to Hillary Care. That plan, with only a few adjustments, became Obamacare. Now, Obamacare's whole concept was this: we will force everybody to buy insurance. We will set up a marketplace to let people buy insurance. Those who can't afford it, those who will expand Medicaid so that everybody who's too poor to get insurance can get insurance. But for everybody else, we're going to tax you if you don't buy a policy. We're going to set up policies. We're going to put subsidies together for the policies. We're going to limit how much every year they can raise the policies. We're going to limit how much profit margin the insurance companies can take. And we're also going to say if somebody has a pre-existing condition, you cannot deny them coverage, you cannot charge them out the wazoo for the coverage, and also you cannot cap coverage. And those last two items are genuinely good things. But here's the thing. Obamacare presumed that the cost of health insurance would be kept down by three factors. One, competition in the state exchanges. Insurance companies would put their offers up on a website where it would be nice and easy for people to figure out where the best deal was. Two, young people, young healthy people who weren't buying insurance would buy insurance and subsidize older people who need more health care. And three, brain fart. I'll come back to three once I remember it. But yeah, here's the problem. First off, John Roberts, in his 5-4 decision that just barely kept Obamacare from being declared unconstitutional, declared that the individual mandate to buy insurance, you could charge a tax for it, but you cannot force people, he said, to buy insurance. You can force people to be part of a government program, but you cannot force them to buy a privately sold product. And so that went away. There's no longer a requirement. Medicaid. He made the Medicaid expansion voluntary. States could refuse it. And 12 still have, including my own home state of Texas. And even those who do expand it aren't necessarily going to expand it very widely. So the poorest of the poor oftentimes are still without health care. And the limitation on how much obviously the limitation on how much they can raise rates per year, that's out the window because my rate went up 42%. It is 142% of my 2025 rate. And then there's the biggest reason of all why insurance prices did not go down. All those young people, young, healthy people who are coming into the system, it turns out they weren't all that healthy. They weren't avoiding buying insurance because they were healthy. They were avoiding buying insurance because they had no money. They were still sick. Working to survive was breaking their bodies down just like it breaks down everybody else's. And as insurance kept going higher and higher, and fewer people offered insurance for their employees, all those union negotiated policies that were so important when Hillary Care was brought through, almost all of those are gone now. Everybody's on an HMO pretty much. The thing is, if the young people coming in are still using bunches of health care, and the older people are still using bunches of health care, where's the savings? And the limitation on how much profit an insurance company can take is only 20%. That means they can put as little as 80% of what they take in towards health care, pocket the remaining 20%, and they're fine. The thing about that is the average profit margin of an insurance company before Obamacare was about 12%, which means the limitation wasn't a limitation at all. So what did Obamacare accomplish? Well, now more people can get insurance. 42 million people this year, 2025, are on Affordable Care Act policies. And I don't know how many more are on Medicaid who otherwise would not be. But that's good by itself. But as far as making healthcare affordable, all that did was change whose pockets the money was coming out of. Most of the Obamacare policies are being paid by the federal government. And since there's no limitation, think about it this way. If you're hurting, you're in pain, and you feel like you're about to die, and someone holds up a magic pill and says, this will make you feel better for a day, how much money will you pay for another day of life? There is no market function that will bring that price down. Most people will pay anything to preserve their life a little longer or just make pain cease for a little while. What the Affordable Care Act is proving, and proving more and more day by day, is not that government can't function. Government can function if you actually have people in government who want it to function, which is definitely not the Republican Party. What the Affordable Care Act proves is that there is no free market answer to universal health care. And it doesn't help that the Affordable Care Act does next to nothing to cover the ongoing price hikes from healthcare providers, from for-profit hospitals and technically non-profit hospitals who operate as if they're for-profit. It does nothing about big pharma, despite all the bullshit that Trump is talking about, how he's making special deals with certain outfits to lower prices. Yeah, he's only making those deals with people who are bribing him, people who are paying for his magically inflating, magically overrun a new ballroom that used to be the East Wing. The costs of healthcare, insurance, providers, medicine, none of those have come down at all. The first time I got an Affordable Care Act policy was in 2016. My premiums per month for that were $300. Next year, it's going to be $1,050, give or take, unless Congress acts. At no point, not in any year, has that come down even by $1. It's been up, level, up. The only way to get prices lower is for us to have national health care. And considering how rapacious the healthcare industry is in this country, I don't think national health insurance is enough. I believe we need to have top to bottom government-run healthcare. Government's funding medicine research? Fine. Government makes the pills. You've got rural hospitals and local nonprofit or government-run hospitals closing because of lack of funding. Federal government takes them over, reopens them, puts doctors in them. We have half the number of doctors per capita of almost any other civilized country. Finance scholarships to get people through medical school. Stop making interns work for essentially free for 2 or 3 years to get their final doctor's approval. We are going to need a radical change in order for healthcare prices to come down. And there's no reason why they can't, except for the invested interests in the for-profit medical industry and the Republicans who want that money going to the medical industry and don't want the money going to poor people like you and me. Right now, the United States pays twice as much per capita as any other country on earth for health care. Nearly 4 times the average of what is called the first world for health care. And still, 1/4 to 1/3 of our people are not getting adequate health care. A lot of them aren't getting any at all, aside from an occasional aspirin or whatever quack medications Bob Kennedy Jr. is hawking this week. Other countries have figured this out. We made a deliberate choice in the 1970s to make healthcare a revenue source instead of a public service. We chose to hurt people, and we've doubled down on that choice for the past 50 years, while the rest of the world actually got on with their lives and took care of their people. The Affordable Care Act can be patched together. It can stagger on a few more years. But if this trend continues, it is going to break down. We cannot sustain this level of inflating premiums for insurance. We cannot sustain this level of inflating healthcare provider costs. These numbers are absolutely outrageous. We are the shame of the planet Earth when it comes to healthcare. But right now, we cannot afford to rip off the bandage. So for today, I support the Democrats in Congress who are fighting to get the Republicans to come to the negotiating table, as they have refused to do since March of this year. Get them to come to the negotiating table and work out a deal that brings these premiums down and allows the Affordable Care Act to go on until we can get something better in place. And for those of you who think that the Republicans are going to put something better in place themselves, Donald Trump has been promising a better plan in 2 weeks since 2017. That is a lot of 2 weeks. He's not revealed a word, nor will he ever, nor will the Republicans ever. Not until they are forced to. So yes, Affordable Care Act for now, but as soon as we can find the support, as soon as we can rally together and put the government back in the hands of the American people, we need something better. We need something truly universal, and we need to take the profit motive out of healthcare. Trust me, I know exactly what I'm talking about on that. I'm Chris Overstreet, and I have opinions.